Hello everyone, welcome back to Jacob's Academy. Today's class we will be learning about the lymphatic system from a histological point of view. So the lymphatic system is an important part of the body that helps in immunity, fluid balance and defense against infections. So as you can see in the diagram, the major components of the lymphatic system include the lymph nodes, thymus, spleen and lymphatic vessels, so which are distributed throughout the body. So in this video we will focus on the microscopic structure of the organs and understand their functions, especially their relevance in nursing practice. So let us begin our class.
In this video, we will cover the complete histology of the lymphatic system step by step. We will begin with a brief introduction and definition, followed by the functions of the lymphatic system. Next, we will discuss the components of the lymphatic system, including lymph and lymphatic vessels. After that, we will focus in detail on the lymph node, its histological structure, and its blood supply, which are very important for exams. We will then move on to the lymphoid organs, including the thymus, spleen, tonsils, and mucosa-associated lymphoid tissue. And towards the end of the video, we will discuss the clinical importance, highlighting what every nurse must know. So followed by a clear summary for easy revision. So please don't skip the video till the end, as each topic is connected and will help to understand the lymphatic system better for both exams and clinical practice. So we'll go to introduction. Now let us begin with the introduction to the lymphatic system. In histology, the lymphatic system is studied to understand the microscopic structure of lymph, lymphatic vessels, lymph nodes, and other lymphoid organs. And the lymphatic system plays an important role in drainage of tissue fluid from different parts of the body, and its help in maintaining proper fluid balance. It is also a major system involved in body defense and immunity, as it helps in protecting the body against infection. So by removing excess fluid and harmful substance, the lymphatic system helps in preventing conditions such as infection and edema. And understanding the histology of the lymphatic system is very important for nursing students, as it helps in correlating the structure with the function and in providing better patient care.
Now let us understanding the definition of lymphatic system. The lymphatic system is a network of lymph, lymphatic vessels, lymph nodes and lymphoid organs present throughout the body. This system performs three very important functions. First one is drainage of excess tissue fluid. So it helps in the drainage of excess tissue fluid from the tissues and returns it back to the circulation, means blood circulation, thereby preventing edema. And coming to second one, immune defense. It plays a major role in immune defense by producing and transporting lymphocytes which protect the body against infections. Coming to third one, absorption of fats, which means the lymphatic system helps in the absorption of fats, especially from the intestine, through specialized lymphatic vessels called lacteals. And therefore, the lymphatic system is essential for fluid balance, immunity and nutrition, so which are very important in nursing practice. Now we can discuss about functions of lymphatic system. The first function is maintaining fluid balance. The lymphatic system collects excess fluid from the tissues and returns it back to the blood circulation. The second function is Absorption of fats from the intestine. Specialized lymphatic vessels called lacteals absorb dietary fats and transport them into the bloodstream. Another important function is providing immunity. The lymphatic system produces and transport lymphocytes which help the body fight against the infections. The second last one, the lymphatic system also helps in removing waste products and toxins from the tissues by filtering lymph through lymph nodes. And the last one is prevents tissue edema. By draining excess tissue fluid, the lymphatic system prevents tissue edema, which is abnormal accumulation of fluid in the tissues. So these functions are clinically important and must be clearly understood by the nursing students for effective patient care. So here one diagram for your reference, lymphatic system, where the lymph nodes, thymus, spleen, lymphatic vessels and all.
Now, let us look at the components of the lymphatic system. The lymphatic system is made up of four main components. The first component is lymph. Lymph is a clear fluid that is formed from tissue fluid and contains lymphocytes. It helps in transport of nutrients, waste materials and immune system. And the second component is lymphatic vessels. These vessels collect lymph from the tissues and carry it towards the lymph nodes and finally back into the blood circulation. The third component is lymph nodes. Lymph nodes act as filters. They remove microorganisms, foreign particles and toxins from the lymph and are important sites for immune response. And the fourth component is lymphoid organs, which include the thymus, spleen, tonsils and MALT. These organs are involved in the production, maturation and activation of lymphocytes. All these components working together to maintain fluid balance, immunity and body defense, which is very important in nursing practice.
Now let us understand lymph. So first we can see the definition. Lymph is a clear colorless fluid derived from tissue fluid. So when excess tissue fluid enters the lymphatic vessels, it is called lymph. So coming to histological features, first one is similar to plasma but less protein, which means lymph is similar to plasma but it contains less protein. And the second point is contains lymphocytes, which means it mainly contains lymphocytes which are important immune cells. And the third point is no RBCs or platelets, which means there are no red blood cells or platelets in lymph. The last one is flow slowly, which means lymph flows slowly through lymphatic vessels. The next one is functions of lymph. So first means lymph returns excess tissue fluid back to the blood, helping maintain fluid balance. A simple term, returns tissue fluid to blood. So coming to next, transport fat, which means especially from the intestine. Yeah. Then the third one is defense against infection, which means the lymph plays a vital role in defense against infection by carrying immune cells. So this concept is very important for nursing students. So please don't skip the video till the end. for better understanding. Now let us discuss lymphatic vessels. So the first point, begins as blind, enter capillaries. So lymphatic vessels begin as blind, entered capillaries in the tissues. So the next one is found in most tissues, which means they are found in most tissues of the body, but they are absent in the brain, cartilage and bone marrow. So coming to histological structure, which means the wall of lymphatic vessels are very thin. And the second one is lined by endothelium, which means they are lined by a single layer of endothelium. And the third point is walls present, which means walls are present which help in the one-way flow of lymph. The last point is resemble vein but thinner, which means structurally lymphatic vessels resemble veins but they are thinner than veins. So we can see the types. Which are the types of lymphatic vessels? The first one is lymph capillaries, which collect tissue fluid, and the second one is collecting vessels, which carry lymph toward lymph nodes, and the third one is lymph trunks, which drain large body regions, and finally lymph ducts, which return lymph to the bloodstream. So this topic is very important for the exam. So please be understand properly.
Now let us learn about lymph nodes. So see the definition here. Lymph nodes are small bean-shaped organs located along the lymphatic vessels. And see the next functions of lymph nodes. First one is filter lymph, which means lymph nodes filter lymph. And the second one is destroy microorganisms, which means they destroy microorganisms and foreign particles. And the third point is produce lymphocytes, which means they produce lymphocytes which are essential for immunity. Next we can see histology of lymph node. Each lymph node is covered by a dense connective tissue capsule. From this capsule, tubercles extend inward, dividing the lymph node into compartments. Next, we can see the internal structure of lymph nodes. So, the lymph nodes has three main regions. The cortex, which contains lymphoid follicles and mainly B lymphocytes. The second one is paracortex, which is rich in T lymphocytes. The third one is medulla, which contain medullary cords and sinus. We can see sinuses. So lymph flows through the subcapsular sinus, then the trabecular sinus, and finally the medullary sinus. So here we can see the image of sinuses. Now let us understand the blood supply of a lymph node. So first we can see the artery enters the lymph node at the hilum. The vein also leaves the lymph node through the hilum. And next is lymph enters the lymph node through afferent lymphatic vessels. And the last one is after filtration, lymph exits through the efferent lymphatic vessel at the hilum. And this arrangement helps in efficient filtration of lymph. Now we can see lymphoid organs. Lymphoid organs are structures that produce and store lymphocytes, which are essential for immunity. The classifications of lymphoid organs are two. First one is primary lymphoid organs, which means where lymphocytes are produced and mature. For example, include bone marrow and thymus. So coming to the secondary lymphoid organ, where lymphocytes become activated, and the examples are lymph nodes, spleen, tonsils, etc. Now let us study the spleen. The spleen is the largest lymphoid organ in the body. It is important to remember that the spleen filters blood, not lymph. So coming to histological structure of spleen, the spleen is covered by a capsule from which trabeculae extend inward, and the spleen has two main components. First one is white pulp and the second one is red pulp. So we can see here. So in white pulp, which means it's rich in lymphocyte, it plays an important role in immune function. And coming to red pulp contains splenic cord and sinusoid. It is involved in filtering blood and removing old or damaged red blood cells. Next, we can see the functions of spleen. The spleen destroys old red blood cells, stores blood, and immune response. It means helps in immune response. See the image of spleen here. Now, let us discuss tonsils. First, we can see the types of tonsils. There are three main types of tonsils. First is the palatine tonsils, which are located on either side of the oropharynx. The second one, the pharyngeal tonsil, also called adenoids, located in the nasopharynx. The third one, the lingual tonsils, which found at the base of the tongue. Next, we can see the histology of tonsils. Tonsils are covered by stratified squamous epithelium. They contain lymphoid vesicles, which are rich in lymphocytes. Crypts are present, which increase the surface area for antigen exposure. Next, we can see the function. Tonsils act as the first line of defense against pathogens enters through the mouth and nose. So here is an image for identifying tonsils. Now let us understand mucosal associated lymphoid tissue, commonly called MALT, M-A-L-T. So MALT refers to lymphoid tissue that is present in the mucosal lining of various organs. So here are some examples of MALT, which include Peyer's patches, which are found in the ileum of the small intestine. Appendix, which contain abundant lymphoid tissue. And the tonsils, which protect the entry points of the respiratory and digestive tracts. So we can see the functions of MALT. The main function of MALT is local immune defense. It protects mucosal surface by detecting and responding to pathogens entering through food, air, and secretions. So this is an important concept for exams and clinical understanding. So we need to know regarding mucosal associated lymphoid tissue.
Now let us discuss the clinical importance of the lymphatic system, which every nurse must know. So one by one we can see here. First one, lymph node enlargement in infection. So during infection, lymph nodes often become enlarged and tender due to increased immune activity. So this is an important clinical sign nurse should observe. And coming to the second point, cancer metastasis via lymph. Means cancer cells can spread through lymphatic vessels to nearby the lymph nodes. That is why lymph nodes are carefully examined in cancer patients. So the third point is edema due to lymph blockage. When lymphatic vessels are blocked, lymph cannot drain properly, so leading to edema, which is known as lymphedema. This may occur after surgery or any radiation therapy center. So importance in biopsy, which means the lymph nodes are commonly used for biopsy to diagnose infection, cancers and other diseases. So these points are very important for the clinical practice and exams. So we can summarize the topic here. So we all know now lymphatic system maintains fluid balance, provides immunity, consists of lymph, vessels, node, organs and essential for defense and drainage. Thank you all for staying with me till the end of the class. So I truly appreciate your time and interest in learning about the topic lymphatic system. And I hope this class has helped you understand the topic more clearly. And I will support you in your studies and clinical practice. So please don't forget to subscribe Jacob's Academy. And please share to your friends as well. So we'll see you in the next class. Once again, thank you. Bye.